CHEB stands for Centers for International Health, Education and Biosecurity. This is a local NGO that collaborates with the Ministry of Health and several other partners in health to strengthen health systems in Kenya. The prime recipient for the Boresha grant was University of Maryland, Baltimore, and CHEB Kenya was formed out of University of Maryland as a local organization. So we were subgranted, that is CHEB was subgranted to implement the scope that was Boresha Maabara scope. And as the CEO for that organization, essentially I supported the teams in achieving or implementing the scope that was provided to the grant.
The goals that were set out for the Boresha program covered essentially 6 areas, with the key objective being to ensure an efficient and effective national viral load and early infant diagnosis network, to ensure that there was timely access to viral load testing and also timely early infant diagnosis. Yes, and secondly, to ensure that quality management systems were in place so that the processes and the results were quality assured.
So a lot of the things that I came in January as a physician, hand washing, infection prevention and control, have been really re-emphasized, and as a result of the training, as a result of the lab initiatives, we now have a very robust infection prevention committee that has had full training. They feel empowered in their roles. Our new infection prevention control nurse has learnt a lot from the University of Maryland team. We had partners to work with us through this season of COVID. So the thoughts that I had as a physician, as a doctor, that we need to go back to basics were further reinforced. We have better lab machines, so we are looking forward to doing better and more lab investigations. And the process of lab accreditation makes us a leading facility in the whole of North Kenya right now, not just for Igembe South, not just for Meru County, because there's only 2 other facilities that are accredited similarly in the whole Meru County, which is a very big area. And I think our neighbors, Isiolo and the other dry counties, is none. So we are looking forward to being a leading teaching and referral hospital because of the support that we have received.
The department has really improved in terms of infrastructure, equipment maintenance, tests running, which are being run, because initially, well, we were not doing what we are supposed to have been doing, but they have guided us. All tests that are run now are run after controls have been run and have passed. So our equipments are up to date in terms of maintenance, calibration. Yes, they have been doing all that. So the department has really gained a lot in terms of the working. And the staff also have been trained on QMS. They have been trained on internal audit. They can audit themselves in the department where there is an issue. They raise CAPAs and then they sort out those issues also.
My responsibility, first of all, is facilitative leadership, to make sure that all the departments in the health are working. And the Boresha implementation was supposed to be led by myself as the CEC, but of course with a lot of delegation to the lab coordinator. My role in that was to make sure that all the implementation processes and requirements that were geared towards making sure that it works are done. One of the things that we were doing is that I would hold meetings with them, first of all to get the checklist of whatever it is that had to be done, and also to supervise and to get reports as the process continued. And let me say that the team that I was given, even from UMB, worked with us very well, and they were very committed, and my team was also very committed. Now, as a county government, you know the responsibility of making sure that our laboratory work is ours. And health being a devolved function, one of the things that we really made sure was that the reagents, the staffing, the equipment, the infrastructure are put in place so that we can be able to achieve the quality of service.
Boresha was set to ensure that we implement quality management system at the facilities. That means both the national and the county facilities. We started with the National Public Health Laboratories, National TB Reference Lab, where we supported the laboratory to accreditation. We also maintained the accreditation for the National HIV Reference Lab, and we also supported the county laboratories, the 27 laboratories for accreditation. We supported 16 of those laboratories to accreditation. 4 of them have also been recommended for accreditation, and 1 is awaiting for KENA's assessment. Another aspect was the PT production unit at the National Public Health Laboratories. We also managed to implement a system there based on ISO 17043, and now we are waiting for assessment by the Kenya National Accreditation Services. The ISO certification or accreditation was important for the facilities because by implementing the standards, we are able to achieve a correct turnaround time for results, credible results for the patients. We are also able to improve on the workflow for the facilities and also enable the facilities to give out reports that will be able to support in policy making. The laboratory staff are already equipped, they are knowledgeable on the ISO standards, and they are able to sustain the accreditation. This is evident because we are able to utilize some of the staff in the laboratories to support other facilities towards accreditation. They will also lead to cost reduction because they have been able to do the inventories, and that will lead to reduction on expiries or the reagents that expire in the laboratories.
So the impact which the Boresha has done in this program is that really it has meant that it has transferred the capacity from the technical advisors to the people who are working within the program. That people now are able to do things towards quality issues. If we were to maintain the ISO accreditation within the lab, people are able to do that. They know what is quality indicators we are looking at. The workload is harmonized. We have standardized policies and tools that people use the same ones. All the testing labs within the country now are all of them accredited, and because of the support we have gotten from the program. We have developed policies. People have been mentored on how to even review their data, what they produce within the lab, and they use for decision making. Whatever we have done in scale-up of viral load has made this the program to be a model country. So we've shared best practices among those member states. We've done over 2 million tests so far. So it's among the countries who does a lot of workload, and they maintain standards within that.
Strengthening the viral load EID network, I think, is a key area that we are very proud of as Boresha Maabara. We're able to bring together the 10 referral labs through bi-weekly meetings and monthly technical working group meetings to review processes to ensure that these labs that are supporting over 1 million HIV-infected Kenyans on antiretroviral treatment to access necessary tests to influence their treatment, that these labs are able to support these individuals in a seamless manner. So you can imagine 1 million people accessing these vital tests in 10 labs in the entire country. And also making sure that the sample network for those samples to move from the peripheries, be it Moyale or Mandera, down to the coast, to the central lab where they need to be tested, are seamless and are robust.
In the new dispensation of health in the country, the national government plays the role of providing quality services, so and safeguarding quality services. So definitely we have to ensure that our labs are offering quality services at the national level. That's why it actually came in central. For example, the National TB Reference Laboratory safeguards the quality of testing for all people that do TB testing in the country. So it was important for us to have quality at the national level. So that's why quality became one of actually the central point of all that we are doing in our labs in the project. Yeah. We serve the national, it's the national population. That's what I was saying. For example, when we do our HIV QA work, it is for every lab, is every person who does HIV testing in the country. So it's across board, yeah. Then, for example, when we work with the equipment management program, we set that up. When you do that, you maintain equipment for laboratories all over the country. So, and you'll find they serve different individuals, from even the populations that they serve out there. So that's why I said interesting, because it serves every Kenyan. In a way, we serve every Kenyan. Our reach is out there to every Kenyan that is there.
Boresha Maabara has had significant impact in this country. At national level, I'm happy to say that we've had significant growth and oversight by the national public health labs of lab services in this country has been remarkable. In these 6 years that the grant was in existence, we were able to come up with significant and multiple policies and guidelines to guide lab activities. And this is not just around HIV-related testing. It included blood services, it included biosafety. So those policies and guidelines we have supported, we've participated in those technical working groups. It would be incomplete or for us to finish without really just saying a big thank you to our donors, CDC. This is a journey that we've walked with CDC, the Centers for Disease Control Kenya program. Our activity manager, who was Dr. Mudhoni, along with a team headed by Jane, Dr. Jane. This is a team that really has worked closely with us. So while we were the implementers, we had quarterly meetings with them to review our progress, to review our strategies, to re-strategize. They brought in best practices from other partners, from other countries, and they brought in their whole expertise, so the CDC team. And I can tell you, these were intense meetings. You would sit in a boardroom, you're sitting with experts, you're reviewing your data, and they're saying, listen, how about changing tact to this? Have you reviewed what other people are doing in other countries? These are the best practices. This is what we've seen. So because of that, it allowed us a forum where as intellectuals were able to come together, bring our thoughts together, and were guided during the entire process. And I would say that without that, we may not have been able to achieve what we did. So I really want to, on behalf of UMB and on behalf of CHEP Kenya, to just thank CDC for their technical guidance, for trusting us with this donation, with this grant, and for seeing it through to its fruition, to this success that we now celebrate.